Welcome to Breakfast with Spaniels with Dr. Judy Morgan. Remember, you can purchase all of Dr. Morgan's products at her website at www.drjudymorgan.com. Now it's time to sit back, relax, and enjoy the show.
What did we decide today was the 6th?
Oh, yes. That's it.
Yes. It's the 6th. It's the 6th and there's still no baby. We are waiting. She says all's quiet on the home front. Mild contractions. Got a good night's sleep. Feeling rested and ready to roll. We'll see. And I don't know if you show that it probably can't tell, but it is literally dark outside. It looks like night. Apparently there's some really horrendous storms coming, which I'm probably going to hit just about the time, they'll hit us about the time I jump in the car to drive to work.
Basically, yes. That's the plan.
Yeah, the plan is. Saw the news and it was hitting Delaware with like a gajillion lightning strikes and just looks kind of nasty. So, but it looks like it's midnight outside. It's really, really dark. So, due date was this past Sunday, the 2nd. It's the 6th. Me. So we shall see. Okay. So Deb Trey Montana has asked the last couple of days if I would talk about laryngeal paralysis. So I'm going to do that. Laryngeal paralysis is a disease where the airway, the top of the airway, the larynx. So we have the larynx goes into the trachea, and at the front of the larynx, there's these two flaps that open and close. So when you breathe in, they open. And then when you swallow, they close so that you don't inhale food and saliva. And you know those times when you kind of breathe in and swallow at the same time and you inhale something down your trachea and your airway and you're doubled over and you can't get any breath because your larynx is in spasm. Yeah, that's the area we're talking about. So with these dogs, and it's common in horses as well. In horses, it's called roaring. In dogs, we get this really raspy upper airway noise. And either one or both of those cartilage flaps doesn't work correctly. So if they have paralysis of those flaps, basically they're kind of half covering the airway all the time, but they don't close completely. So the dogs are really prone to aspiration pneumonia. They're prone to getting a lot of swelling and edema down in that area anytime they undergo stress or exercise. So hot, humid weather, absolutely the worst for these dogs. Probably the most common in Labrador retrievers, golden retrievers. We see it a lot in dogs that are 10, 12, 14 years old. It is definitely related to hypothyroidism. So anytime I hear a dog that's doing that upper airway noise, I will definitely recommend testing the thyroid and getting that treated. Unfortunately, because what it is, it's a paralysis of the nerves. The nerve endings become inflamed and stop working. And hypothyroid disease is also an autoimmune disease where the thyroid is attacked. So kind of makes sense that everything happens in that same area if we've got this autoimmune reaction happening in the throat and neck area and those nerve endings. So we definitely want to treat the hypothyroidism. Laryngeal paralysis is not really reversible. Things that we can do to support it, the nerves are part of the kidney and water system. So anything that we would use to support bone or kidney is also going to support the marrow, which is the nerves in the central nervous system. Probably going to need cooling proteins, cooling foods for these dogs. Almost all of them are hot dogs because they've got this autoimmune thing going on. Steroids will not help, so not recommended for this unless they have a lot of swelling and edema down there. So when I worked in emergency one time, a big fat Labrador was brought in respiratory distress. It had laryngeal paralysis. And we put the dog in air conditioning, we put it on oxygen, and it just was not getting better. And we ended up having to do an emergency tracheotomy, which happens with these dogs. If you have an older dog that is starting to develop this, you want to get the weight off of them if they are overweight. And that might mean that, if they're hypothyroid, they're going to tend to be overweight. There's the thunder, tend to be overweight as well. So, we want to control weight. We want to feed them things that are going to help the water system. So bone broth, fish, eggs, kidney, all those kinds of things will help try to stabilize it because it will continue to progress and it will get worse. There is a surgery called laryngeal Tieback surgery where they basically take those two flaps, they open them and suture them open. Biggest problem with that is now there's no way that they can close their airway when they eat and drink. And almost all those dogs that have that surgery will end up with aspiration pneumonia. If they survive it one time, they'll get it again. When I worked in ER, we had a lot of these dogs that lived in ICU because they just came back with aspiration pneumonia time after time after time. There is a medication called Doxepin, Doxepin, that is sort of advertised as maybe helping with this. I haven't had great luck with it. CBD oil as an anti-inflammatory may help. But the big thing with these dogs is you keep them cool. You keep them in non-humid environments. You keep them inside, decrease stress, no exercise at all if it's hot, humid. And, keep good airflow around them. That's really what it's about. So, and if they get into distress, it is a big problem. Just, you've got to get airflow for them. And if they get enough swelling down there, there just is no airflow. I don't think I've ever seen a dog get a permanent tracheotomy because of this. Most clients would pull the plug before that, unfortunately, because having a permanent tracheotomy is pretty much a nightmare to deal with. So laryngeal paralysis is a problem. It is a progressive disease, and we want to do everything we can to slow it down, and we want to be very careful how we exercise those dogs and how we treat those dogs. Okay. Watching a lab that gags every time she drinks water. Yeah, that may be part of it. Definitely can be part of it. A dog eating dirt, I would check for intestinal parasites, and I would check for anemia. Usually they're looking for iron. They generally need B vitamin and iron, so dark leafy greens, liver, beef, blood tonics, but also check for parasites. Hookworms, it's an intestinal parasite that actually sucks blood. No, Mary Jo Sedgwick, you do not need prescription diet for life with bladder crystals, especially in a 1-year-old dog. Please don't do that. Please look on my website and my YouTube, drjudymorgan.com. I have tons of videos, blogs, information in my books about treating that they're just selling you food that is expensive and crappy. Really not good.